Hello, my name is Leslie Conley and I am with Amy Case today, and we are going to be doing the response discussion. And our question of the day is, because healthcare is a for-profit industry, what considerations may go into development of treatment/enhancement technologies beyond simply patient care? And there was no video posted yet for the original discussion question, so we are responding to the module.
So to kind of begin with that and to answer the question, one of the biggest things that people often struggle with is like pharmaceutical companies and if it's safe for them to be publishing their medications because they are working for a profit, not for profit. So a lot of the times people argue that pharmaceutical companies are not submitting all the correct things, or maybe we're being too lenient on them, when in all reality, I think that pharmaceutical companies are held to a pretty high standard, and in their marketing, they are giving, here are the things that could help with, here are the things that could not help with, because it's kind of a life or death situation. You're ingesting a medication that could potentially cause harm instead of good. With that being said, pharmaceutical companies really do offer some great tools and medications to help people live their daily lives to the best of their ability, which would then in turn help them to have a better treatment and enhancement plan, as well as they are not suffering as much. And for me personally, I feel like if you have the ability to make the decision, use your autonomy to create that I want to do this, then you should be able to take the drugs that the pharmaceutical companies do provide for you.
Yeah, I totally agree. Also, some people may find it controversial that people are making profit off of medications that are necessary as humans, but these companies have to run somehow. Like, the people they are hiring need high-level degrees and many years of education in order to work in this industry. So it's important that these employees are getting paid so that we can keep this system and process running to keep everyone healthy and able to continue with their activities of daily living and whatnot. So it's pivotal that these people are getting paid, and they have to make somewhat of a profit, because if they're not, there's no way to keep paying the employees and keep running the businesses that are creating these medications for people. And pharmacists go through a lot of schooling, and it's important that they make enough money to pay off their education and to continue being humans like everyone else is. And it's important that they keep running these industries.
And I think finally, to kind of piggyback off of that again, something that you had mentioned was these medications are crucial to patients living a successful life. And it kind of reminds me of insulin and diabetes, and people who suffer with type 1 or type 2 need insulin to survive, and pharmaceuticals are creating that and then sending it out. But those vials of insulin are priced pretty high because of all the schooling and the science put behind it to measure out the right amount, so people aren't taking the wrong dosage.
Yes, and that was our response discussion for the question of the day. Thank you.